Hello. Ladies and gentlemen, we are starting. Please take your seats. Thank you.
This is for the computer.
Sí. Can you explain to people with an S? Let's start this second session. I promise you it will be an extremely important one, a critical one. We finished with our opening, the excitement, the testimonies. Let's now move on a session with very strong demonstrations of things that are working, science again, and of course some panelists that I'm sure you will enjoy. We are already late, but this is, I suppose, the price to pay on the first day, or maybe to have a very bad moderator. But it is my pleasure now with our retraining people more from the presentation by Dr. Francesco Forestieri. He's the National Research Council from Italy, and of course a visiting professor from the Imperial College of London. And he has been supporting and working with WHO for a very long time. So Francesco, please, you have the floor.
Good morning, everybody. Buenos dias. It's a pleasure for me to be here, and I congratulate with WHO for this wonderful conference we call the Woodstock of air pollution. And I think this term is very good. And my mission today, my mission today is to make a short summary, and Maria said 9 minutes, no more, of the 20,000 gigabytes of the scientific evidence relating air pollution with health. And this is a challenge, of course, but I have, most of the big data have been already presented, so I have advantage of this. So I might start with something that was back in the 70 and 80 years ago, when doctors were making publicity of cigarettes, Lucky Strike in this case. But then in the British Medical Journal, the results of the British doctor study was published indicating the relationship between smoking and lung cancer. And since then, a lot of research has been conducted on smoking, and today the risk of smoking is very clear, and smoking causes damage to many parts of the body. And you might say, why you are presenting this? Because let's say for air pollution today is the same. We started with research on respiratory system, on respiratory diseases, and nowadays it's clear that cause damage to the cardiovascular system, the cerebral system, the metabolic system, and even reproductive health. The killers come from different parts. The killers come from the outdoor, the anthropogenic sources of air pollution, but they also come, and this is very important to remark in this conference, from indoor sources, from households. And why I say this? Because WHO has been involved and committed to fight air pollution from the two parts, from the outdoor and the household source. And as you see, I don't repeat, the sources have various killers. It's not only one, so it's more difficult to fight. And we like the comparative risk assessment, and this is the comparative risk assessment from GBD, Global Burden of Disease, in 2021. And you see the ranking here. What I did in this specific case, separate the ambient air pollution, which is causing 4.7 million premature deaths, and household air pollution with more than 3 million deaths. In total, when you sum them and also add ozone air pollution, it's 8.1 million. This is the estimate for 2021. And as it has been said, it's the second largest risk factor after blood pressure, South Asia and Africa have the highest burden. But don't forget about children. The estimate is that 700,000 total deaths are due to air pollution in total, and the largest burden is in Asia and in Africa. We already know this is the proportion of global death from specific causes attributable to total air pollution. It's very high for COPD, but also for ischemic heart disease, stroke, lung cancer, and diabetes. This has been said, this is non-communicable disease, so air pollution is a very strong risk factor. And then, this is why we have the air quality guidelines that was published in 2021. This is our guide, is the guide of our commitment. But people may ask, how did we get here? How did we get to this conference? And this is a long journey coming from the London smog episode in December 1952, causing more than 4,000 deaths. And other disaster, not only in Europe, but also in the US. And now we have evidence that has been collected in the air quality guidelines. And what is this evidence? Scientific evidence. It's a massive combination of large epidemiological studies, toxicological studies, and even clinical investigation. And I cannot summarize the massive evidence, but just have some examples. When people ask me, what's, especially clinicians, what's the mechanistic evidence? You say air pollution is causing atherosclerosis, but where is the evidence? And the evidence goes back to 2005, it's 20 years old. This is a wonderful experiment that was done in the US, actually New York. They exposed mice to normal diet and high-fat diet, and also to filter air and concentrated PM 2.5 from New York. And you see the results. You know, diet, high-fat diet is a very powerful determinant of atherosclerosis, but also air pollution exposure. So you see the lumen of the blood vessel is obstructed from the exposure. And this is very strong evidence coming 20 years ago. Another example of study is a study that was conducted, published in 2007. This is incredible. It's a small group of people with 25 subjects with previous ischemic heart disease. They had exercise-induced stress with the bike, you know what it is. And they have been followed during the exercise and exposed to filter air or diesel exhaust. And it's very clear that people exposed during the exposure to diesel exhaust, they had a very precise sign of myocardial ischemia, which is ST depression in the electrocardiogram. So this is very strong evidence from a clinical study. But let's go to epidemiology, and let's go to the mechanism. The mechanism is very clear. Each inhalation, we have millions of particles in our lung. And these particles are separated. The large particles remain, are trapped. The smaller ones go to the bronchi, and the fine particles got into the alveoli, and the ultrafine particles may enter into the bloodstream. And the effect has been studied from several mechanistic studies, like oxidative stress, inflammation of the lung, cancer of the lung, transfer of inflammatory mediator into the blood stream and reach different organs and produce short and long-term effects. I said, let's go to the epidemiology. The epidemiology first started with time series studies. This is a paper published in 2019. It's about short-term effect on mortality in 652 cities. And this is showing a very clear exposure-response function relationship between PM 2.5 and daily mortality. But also are important the results for the long-term effect, and these are the results of the three large cores that were funded by the Health Effect Institute. They are called the low-level studies conducted in Canada, in US and Europe. And all these studies, they show the same exposure-response relationship between PM 2.5, even a level around, starting from around 5 micrograms cubic meter, a very close exposure response. And this is coming from millions of subjects involved in the studies. So after the studies, what we have from US EPA, we have to defend the US EPA, remember this? We have several causality determination. What is causality determination? It's bringing together toxicology, epidemiology, and having a response to the question, is a causal relationship. And you see that for some relationship, the determination of the US EPA is causal. For others, likely to be causal, and for others is suggestive to be causal. And we have for PM 2.5, for NO2, and for ozone. We have concentration response function for several diseases, and this is coming from a WHO project which is called EMAPEC, providing exposure response function for impact assessment. And this is a recent publication, and this is based on systematic reviews for each specific exposure outcome pair. And you see this is, for example, is PM 2.5, a stroke. So the evidence is overwhelming. And it's important to say air pollution is for everyone, but some people are at greater risk. And you have a discussion here that I will not go through susceptibility and vulnerability, but it's very important to say that babies and children, pregnant women, elderly, people with chronic diseases like asthma, COPD, ischemic heart disease, heart failure, diabetes, and cancer are more at risk. And more important, nowadays, people of lower socioeconomic status are higher risk because they live near air pollution hotspots, they have poor access to health care, or they have a poor lifestyle. So we need to remember this susceptibility and vulnerability at risk. So in conclusion, we know this air pollution is the most significant external threat to human health. Everybody is affected, but we have vulnerable groups. We need to protect the population, limiting the concentration values according to WHO. And as Maria says, we need to act now. Thank you.
Wonderful, Francesco Forestieri. Thank you very much. It is my great honor now to move on a country experience, in a positive country experience. So my pleasure to give the floor to Professor Shen Hongbing, Vice Minister, National Health Commission and Administrator, National Disease Control and Prevention Administration, China. Sir, you have the floor.
Thank you, Maria. So, distinguished guests, ladies and gentlemen, good afternoon. So, it's really my great honor to be here, and thank WHO for inviting me to this conference. I'm going to represent China, their Health Commission. Okay, here is. Sorry for the, okay, here, yeah. Represent the China National Health Commission, the National Disease Control and Prevention Administration, and the China CDC to present the topic of China's successful fight against air pollution over the past decade. Here is the outline. There's 4 parts. The first part is China's achievements. So over the last decade, the Chinese government has implemented a series of strong measures to continuously to improve the air quality. And from 2013 to 2024, the percentage of days with good air quality in Chinese cities increased from 61% to 87%. Take Beijing as an example. We can see that days with good air quality in Beijing increased significantly in the same time area. And the days with heavy air pollution in Beijing is decreased dramatically. So last year, only 2 days in Beijing. So Beijing blue and the China blue have gradually become a normal part of people's daily life. While we can see the PM 2.5 decreasing continuously, so by 60% over the past decade. So China, the GDP grew continuously from 60 trillion in 2013 to 135 trillion 2024. That's almost more than doubled. It demonstrates that simultaneous achievements of improved air quality and steady economic growth, it's proven that it's a practical model of green development in developing countries. In addition to the PM 2.5, there are other pollutants like PM10, sulfur dioxide, nitrogen dioxide, and carbon monoxide. These are all decreasing continuously, except the ozone. The ozone, we can see that in several years, even ozone pollution is increased in some cities. And the significant reduction in major pollutant concentration in three key represent regions in China. We can say Beijing, Tianjin, and Hebei, the region. That's the heavy pollutant area previously. Then the Yangtze River, including Shanghai, and the Pearl River Delta, including close to Hong Kong. These represent areas all decreased, leading to a remarkable improvement in air quality. So China's air pollution control has brought significant health benefits. We can see from 2013 to 2020, they lead to an increase of 5.8 months in the average life expectancy per person, only these 8 years, and have prevented 563,000 premature deaths. That's we estimated this kind of the figures. And the second part is China's experience. So the achievements over the last decade, we achieved a lot, the government. So these achievements are attributable mainly on the national strategic planning, the technological innovation support, pollution source control, health risk prevention, and control relaxation. So in terms of national strategic planning, we can see China has adhered to the strategy of prioritizing health development, guided by ecological civilization construction. So this including the action plans like air pollution prevention control action plan, and related the national strategic planning, a series of these the planning system. And through the implementation of these policies, China has integrated the construction of a beautiful China with the goal of a healthy China. So beautiful and the healthy. That's the goal of our achievements. So in terms of scientific and technological innovation support, the Chinese government has invested over 100 billion renminbi to strengthen research and development across the entire chain, including pollution causes, formation mechanism, health impacts, emission reduction technologies, and governance solutions. So in terms of the pollution source control, the government has accelerated the energy construction transformation by controlling the traditional energy consumption, and on the other hand, by promoting the transformation to clean energy. So by 2020, national core share of total energy consumption fall below 58%. And it's continue to decline and reach 53% by 2024. On the other hand, the share of clean energy consumption continued to rise and reach 28.6%. So the green bar is the clean energy, the red bar is the core share. So we can see the transition. And in terms of high-risk prevention and control, we continually strengthen the two major monitoring networks for air quality and health impacts in the whole country. So we can see that for air quality, the monitoring network during this year, we have over 2,000 monitoring points, cover 6 pollutants. And we have 167 monitoring points for health outcome monitoring and literacy. So this is the system, the monitoring networks. And also the government developed innovative health protection technologies. So the one side is building the health protection guideline system from air pollution protection translated to air pollution plus climate protection. So including heat wave, cold wave, and climate change. So this is the government issue the guideline systems, and also the empowering the health risk early warning with digital intelligence. So from air quality, weather forecast, that's regular report, and then translated to air quality, weather health risk early warning and forecasting. So we are trying to this transition to the health risk early warning. And also the government encouraged to promote the whole society participation in co-construction of healthy environment. And the health department hosted the essay and the paintings, the competition in primary school students and secondary school students to inspiring the mission and the responsibility of the young generation for the environmental health issues. So in this conference, just outside this room, we have a painting exhibition for the primary school and the secondary school students. So I think you may notice that there is an exhibition, and I welcome you to have a look at that. So the third part is the new challenges. So new challenges, say we are now at 2024. That's we are at 29. So there is still the gap. So we between the current level and the WHO guideline value. So great effort is needed to attain the WHO guideline level. And in addition, there are new pollutants plus the traditional pollutants. So these are the challenges for health effects. And another one is climate change. So like heat plus ozone is increasing, as just mentioned that, and the heat, wildfire, and the sand and dust storm increased significantly. This is also, there are health effects, obviously. So the fourth part is the shared future. So clean air, healthy air shared global target. So they just mentioned, everyone know that 99% of the population lives with the unhealthy air. So as a big and responsible nation, China will actively respond to WHO air pollution control initiatives. So the government will continuously to implement the strategies and actions like Healthy China, Beautiful China, and Adore Carbon to improve the national standards of air quality, to improve the capacity of monitoring early warning system, the capacity construction and the technology development and the global collaboration. So there are goals that we already set up, and the Healthy China by 2030, the Beautiful China 2050, and carbon neutrality 2060. So the last one, I would like to say that China is willing to share clean air action experience with the world. Although we need to do more, there is a gap still. We need to make great effort to improve the air quality. And also, we should learn from each other, learn from you, the other nations' experience, and let's work together to build a community with a shared future for mankind. Thank you for your attention.
I'm sure everybody agrees with me that this was a very positive, stimulating, and demonstration that it can be done. So thank you very much, China, for sharing with us this incredible experience. I really hope that between now and the end of the conference, we will be able to hear more from those type of commitments and the demonstration that we can provide clean air for our population. It's feasible if there is the political commitment, science is behind. This is my pleasure now to invite my panelists. Come on, what are you doing? You should be here by now. Come on, come on. We are late already with the program. Welcome, everyone. Thank you so much, and thanks for accepting my sense of humor. And I think I will start with you, Mr. Ronaldo. Yes, hello. Can I start with you? You are from the Philippines. You are the director of the Health and Climate Change Office at the Ministry of Health in the Philippines. And it looks like Philippines have something good as well to share with us. You have some good progress. Share with us, please. How did you do it? What were the political obstacles? What has motivated you? And whether this is working or not. And how much committed you are to get it even to another level. That's my part. Maybe you don't. Go ahead.
Okay. Buenos dias. Good morning. And then thank you to the government of Colombia and, of course, WHO for having us here. To start with, the Philippines is faced with a lot of public health issues. But now we have to look at air pollution as a top priority. So in 2019, when we were busy responding to COVID, very grim statistics came out. Out of 120 million Filipinos, 66,000 of them had died just because of air pollution. So how much of this is related to economic losses? So this translates to 17% of our gross domestic product. And most of this affected our dear elderlies, our kids, small children in the Philippines. So something must be done. So a year after when we did our survey, so our air quality standards exceeded that of the WHO. So something must be done urgently. So the Department of Health cannot do it alone. We have here in the Philippines, our country is represented here by the Ministry of Environment. So our Ministry of Environment saw that important need. And of course, with a lot of pushing from the health sector community, some of the leading statisticians, epidemiologists, clinicians, and of course, communities who were affected by it. So we all saw the need to update our PM 2.5 standards. So out of that, we came out with that, and that is somehow the work that we have been doing. And other than that, of course, we're working on the other pollutants as well. So we have created a very good coordination mechanism between the Health and Environment Ministry, which brings together all the other government agencies, even private sector, civil society, and academia to work on improving air quality standards. Of course, that's good progress. Much has been done, but of course, much still needs to be done. So I'll stop here, Maria. Thank you so much.
Thank you. And I see that the health argument has been very important to motivate this action by the Ministry of Environment, correct, and the government in general. I suppose you are collecting as well the health benefit that this is originating in order to use it for more, more motivation for more policies. Is that the case?
Yeah, for sure. So we're doing a lot of things related to climate change mitigation. So the health ministry still has to work with other sectors. So the interagency committee brings the transportation colleagues, energy, those working in the local government, even the science and technology, to bring about the health co-benefits. And now we're facing heat waves. We have volcanoes erupting, and air pollution becomes a secondary issue. And then, of course, the extreme weather impacts. So we have to tie up the issue of air pollution as well with the climate change impacts. So we believe that, of course, air pollution contributes to climate change, and climate change also exacerbates air pollution. So it's a very vicious relationship that has to stop. And then we make sure that in the health sector, we're front and center in this big fight. But much still needs to be done, of course, starting with our bold initiatives towards air pollution, Maria.
Thank you so much. And I'm not giving the titles of the panelists because you can see it on the screen, so allow me to call you just by name. So Purmina, last year a very important report was launched, and of course in WHO we were extremely happy because the World Health Federation were really on that report putting a lot of emphasis on the importance of air pollution. Tell us a little bit about this report and why you decided to look at that very strongly. For us, it's extremely important.
Thank you, Maria, and good afternoon, everyone. I come from India, a country which has the dubious distinction of hosting 15 of the 20 most polluted cities in the world, but also having a growing burden of non-communicable diseases. So while I'll wear the WHF hat here in the panel, I will say that it's an issue close to my heart back home. We've heard all the statistics about non-communicable diseases burden growing around the world and air pollution being introduced, rightly so, at the UN high-level meeting some years ago as the 5th risk factor for non-communicable diseases. But as much as we learned about tobacco and smoking and the links to non-communicable diseases, air pollution hasn't found its pride of place in the medical armamentarium. And I think World Heart Federation really needed to take action on that front. We are an umbrella organization which has a membership of 250 organizations, foundations, scientific societies, and patient representative organizations with a global footprint in every continent. And I think what we needed to do right away is to take action to change the perspective that we had, because a survey that was done by the World Heart Federation in 2020 showed that while we accepted the communities of practice, the cardiologists, the patients, accepted that there's likely a link between air pollution and non-communicable diseases, they said that they were not empowered with the tools and the armamentarium to address the problem. I think the World Heart Federation right away took concerted action, established an expert group for air pollution, now known as the Air Pollution and Climate Change Group for obvious reasons, and started addressing the gaps that they saw in the air community. And one of the first things that they did was to produce a joint action statement in all the leading cardiology journals, a beautiful policy brief on air pollution and the links to cardiovascular disease. But most importantly, the capstone publication, their annual report in 2024, decided to bring the focus front and center to their community on air pollution and the links to cardiovascular disease. The report was very well received, but we can't stop with just the report. Cardiologists are busy and they're not going to be reading the report. So what we've done now is working with WHO, hosting regional webinars with the WHO regional offices, contextualizing the report and its key findings, the recommendations to the regions of the world. And I think this is also important because it means that we need to contextualize and humanize the problem for even our cardiologists. For example, in India, it's increasingly seen that younger and younger people are falling prey to this disease. Late 40s, early 50s, a man falling prey to a heart attack means the entire household is impoverished, not least because of the repeated medication, the hospitalizations. So bringing those narratives to our cardiologists and making them the credible voices that are feeding into programs and policies is important. And I think an important piece there for the cardiology community is also to be fed the homegrown research from the different regions. And I will take an example from India. For example, our own research shows that in Delhi, which is one of the most polluted cities, you can experience the airport outside, we found that every 25 micrograms increase in particulate matter, the culprit pollutant, increases the blood pressure of an individual in the city of Delhi by 3 to 5 millimeters of mercury. Sounds insignificant, but what it means really is if the administrators in the city of Delhi took concerted action to address air quality in the city, we could reduce the prevalence of hypertension in the city by 10 to 15%. That's a whopping figure. And in the era of trying to achieve universal health coverage, imagine the number of people that could be prevented from accessing an already overburdened health system for treatment of blood pressure. So that's the kind of narratives we would like to empower our cardiologists with. Give them these kind of stories, the narratives, because they are the credible voices that can be feeding into programs and policies. And I think our next steps would be to build those advocacy toolkits for our communities of practice, which will then be used by them to feed into local policies and programs. I'll stop there.
Yeah, thank you. And, you know, since air pollution has been recognized at the high-level meeting at the General Assembly in New York as one of the 5 risk factors for NCDs, we have been fighting very strongly to make sure that air pollution was really incorporated in these 2 communities. They should talk a lot. I mean, NCDs and air pollution. You think we are closer to that? You think we can join efforts and then make sure that we tackle the causes of non-communicable diseases in advancing on our air pollution fight?
I think with partners like the WHO, we can get there. I think we really made a good start. And we are trying to decentralize. I mean, keeping the global conversations in the World Health Assemblies, in global conferences like this one, or in the UN General Assembly is important. But I think decentralizing action and taking it to the regions on the ground is where we'll start to make a difference. I think those kind of nudges will really make the change.
Thank you so much. Mary, I need to hear from you on experiences on infectious diseases and air pollution. What do you see and what do you want to share with us on that?
Thank you, Maria, and wonderful to be here today. I'm going to answer this based on my experience as a lung doctor and an ICU doctor and how air pollution affects the patients that I take care of. As we've heard, those invisible gases and particles get all the way down into the lung, where they not only cause inflammation and airway narrowing, but they also impair the immune system. And so that means that my patients with chronic obstructive pulmonary disease or pulmonary fibrosis, when they get an infection like COVID or influenza or bacterial pneumonia, their immune system is not as effective in fighting that off, and they're much more likely to end up in the hospital, in the ICU, and they're much more likely to die of that infection than people without lung disease.
You have personal experience that touched you a lot?
Oh, yes. So I'm an ICU doc, and so in the early days of the pandemic in my city in Boston, we really faced a huge surge of admissions and deaths from COVID-19. And my clinic, where I practice, is in in the town of Chelsea, which is a hotspot for air pollution. It's surrounded by roads. The airport is right there. There's heavy industry. And so it's really a community that's very heavily exposed to air pollution. And it had the highest death rate from COVID in the country for a while. And so I actually saw some of my patients come to the ICU, and one of them passed away.
Well, thank you. Thank you for that. Kathy, you have a very important role. I mean, you are the CEO of the NCD Alliance. The NCD Alliance is a very powerful one. And again, you think that there is enough awareness among the NCD's community about air pollution? And I know that you're preparing this big conference in September at the General Assembly, UN General Assembly. How much we can join forces there, and how is the preparation going?
Thanks, Maria. So, I mean, first, taking the question about awareness. I mean, you've heard the statistics already. 8 million people dying every year from air pollution. 90% of those are related to NCDs. And Maria, your slide earlier was really kind of highlighting the many links between air pollution, ischemic heart disease, stroke, lung cancer, as well as type 2 diabetes, and emerging evidence around the impacts on brain health as well, so Alzheimer's and Parkinson's as well. So this is essentially the NCD agenda that we, the NCD Alliance, work on. Going to your question about, you know, how much awareness is there amongst politicians, the general public, the health sector? I would say in terms of at the political level, it's already been mentioned that, you know, 2018, the last high-level meeting on NCDs at the UN, air pollution was obviously put on the agenda as the 5th risk factor. A big policy change, an important kind of moment in the recognition and awareness of political leaders of air pollution being an important part of the NCD agenda. But I think, as others have alluded to already throughout the sessions earlier, awareness isn't enough. It's how you translate that into action. And I think what we've seen over the last 7 years since that last high-level meeting on NCDs is that there is still a bit of a lag. There's a bit of a disconnect between really cementing and incorporating air pollution as part and parcel of the NCD agenda. And I think you can see that at the global level in terms of the global policy agenda, but also, and more importantly, at the national level. You know, how well is air pollution being incorporated into national NCD action plans, national targets by governments? I think there's still a lot more that we can be doing. And obviously 7 years isn't a huge amount of time in a kind of policy landscape, but I think we're obviously always impatient for change and want to see more. And I think over the course of these sessions already, we've heard the arguments of, you know, the triple win of how integrating air pollution can be of benefit to improving the NCD and accelerating the NCD response, having an impact on planetary health, as well as the economy. And I think the health sector, and when I say the health sector, I mean particularly the NCD community, is really beginning to take on air pollution as part of our agenda. And a colleague from the World Heart Federation has shared one example of that. We're seeing it with the Union for International Cancer Control, the Cancer Federation, as well as many others. Going to the kind of second part of your question about the UN high-level meeting. So the high-level meeting on NCDs and mental health will take place this September, 25th of September in New York. It will be the 4th high-level meeting that we'll have had on NCDs. These meetings are heads of government and heads of state. It's an opportunity to be really reviewing progress that's been made over the last 7 years and renewing commitments. Our message at the NCD Alliance for this high-level meeting is that overall, we haven't seen sufficient progress. We're off track in terms of reaching that target of reducing premature mortality of NCDs by 2025. Only 19 countries are actually on track to achieve that. So my point here is that it's a real opportunity for this community to be further cementing and integrating air pollution into that high-level meeting and into the declaration that all governments of the world will agree. And I'd say from the NCD Alliance perspective, what we would like to see from this high-level meeting, specifically on air pollution and NCDs, is that integration first and foremost. Secondly, it's things like, you know, in NCDs, we talk a lot about the commercial determinants of health, the impact of these health-polluting industries that are driving the burden. Fossil fuel industry, absolutely part and parcel of that. So greater regulation, greater actions to make sure that those industries are not interfering in public health policy, which we know they are in many places. I would say a third one would be about mobilizing investment, really kind of phasing out subsidies for fossil fuels as a way of mobilizing greater resources for health and universal health coverage and NCDs as well. And then a final one, I would say, and I should also kind of plug our side event on Friday, being an opportunity to further strengthen these recommendations, is around data and standardizing data around air pollution as part of NCD surveillance. So I think the message is using the high-level meeting this September as an opportunity in a political window to greater strengthen those connections.
Thank you. Thank you very much. And I have a question for all of you in the little minutes we have in front of us. What can we do to accelerate the role of the health sector? I know that we are doing a lot of efforts, but I'm sure that we can do even more. So what are your ideas to, of course, the resolutions, the UN, and getting together here, but what do we need to do to convince people that this is a major public health issue and they need to react? The role of the health sector. Can I start with you?
Yeah. Maria's looking at the health ministry guy. So, yeah, first, a lot of things has to be done. So collaboration is not a necessity, it's an imperative. So the ministries of environment and other sectors will have to do their thing in terms of improving standards, improving our air quality monitoring. But much of this has to be translated to health action. So in the case of the Philippines, I guess much has to be done in terms of galvanizing actions. So we can make use of important global commitments. And of course, the shining example of following, of course, the leadership of the WHO is something that's important, that will solidify all of these gains. And then working with our sectors when we go back home to our countries. I guess for the health sector, delivering on our mandate to protect the health and well-being of our people better, just like our climate change narrative, it's a problem of the now and the future, and historically it has been a thing that has received less attention. So I think we have to be improving in terms of our way to involve our communities. So creating better awareness around the health issues of air pollution, because the Philippines is faced with lots of issues. So air pollution is just in the background. But something has been said about the fact that it has killed, is killing, and will kill many Filipinos. So something as loud as that voice needs to come out. We need to articulate better that narrative. And then number two, I think we have to improve our way of targeting the vulnerable groups. So evidence is very clear, shouting at us that who to address. So many different kinds of people. Of course, vulnerable groups, indigenous people. The Philippines has a rich culture. We have to target all of this. Indoor air pollution, household. This problem is not yet as recognized yet in our country, but we are convinced that something must be done as well. And I think we have to do the sustainability game better, promoting better the co-benefits. So I believe part of the priorities now of our ministry, Maria, is we're working out with the transport sector, things to do in terms of active transport. We are even promoting mass transport system, and green spaces are going to be very good. So I guess we have to put out our efforts to do more in the health sector, but improve in the way we collaborate with other sectors. And most importantly, I think make sure the voices of our people are heard. So improving community engagement, targeting better the vulnerable groups, and of course, following all the guidelines, recommendations, and the roadmap set forth by our WHO. I think that's a good recipe for a success, at least for the next few years, Maria. Thank you.
Thank you so much. I have 30 seconds for each of you, okay? Go. For me now.
Yeah, maybe all I'll say is that no cardiologist anywhere in the world will have an excuse that he or she is unaware of the links between air pollution and cardiovascular disease, whether it's prevention, treatment, or health promotion.
Fantastic.
I just want to bring the attention of the attendees to the app. If you check the chat, There is a preprint publication that a group of us from the International Society of Environmental Epi put together in advance for this conference of success stories, exactly the kind of success stories that we heard about so far in this session. I think the more we have examples of success that show transport, housing interventions that clean up the air and save lives and save medical costs, the more we can inspire each other. Thank you.
I'd say in terms of making the case for more action on air pollution as part of the health agenda, I would say there are three things that we need. We need messages for the head, the heart, and the pocket. And I think a lot has been said about the epidemiology, the head, the data in terms of the burden. The heart, we heard so many important testimonies and powerful testimonies of putting a face to the impacts that air pollution is having, which is so powerful. And the pocket, you raised the huge economic impact that air pollution is having. I think with these three things, we can really ensure that governments are showing up and taking further action on air pollution as part of NCDs and the health agenda.
Wonderful. Very good recommendations. And yes, we need to remember our patients, our society, that we need to increase the quality of the air they breathe indoors and outdoors. So both are absolutely critical. And since we have been talking about the UN and the General Assembly, it is my pleasure, Astrid, please, to invite you now to hear Astrid Puentes Riaño. She's the UN Special Rapporteur for the human right to a clean, healthy, and sustainable environment. Astrid, you have the floor. Thank you.
Thank you very much. And I will need the slides around. Is it here?
Somebody's coming to help.
There. No, perfect. It's fine. No, está bien. Muchísimas gracias por la invitación.
Thank you so much for the invitation. Congratulations to the World Health Organization for organizing this wonderful conference.
It's for me an honor as a Colombian to be here in Cartagena and address with you all and talk about how can we advance on clean air. And one of the key things that I want to say, not as a special rapporteur only, so I'm the special rapporteur, as you heard, on the human right to a clean, healthy, and sustainable environment, but I'm here also as a lawyer and as a mom, and as a person that lives in Mexico City, breathing the air that we have. And that is the kind of connections that I think it's absolutely key that we all do, because we're not only doctors and cardiologists, we're also moms, and we heard also the story this morning from Ella. This is the challenges that we're facing, and unfortunately, the lack of access and results that we're seeing. And one of the urgent actions, and we heard a little bit about the impact on health, but we haven't heard until now the impact on human rights, because breathing clean air is a human right, as we heard also. It's not a privilege, it's not a favor, it is a human right issue. And so one of the key aspects that we need states to understand, but also institutions, is the importance of including the right to a healthy environment and thinking and solving the clean air as from a human rights perspective. So the right to a healthy environment has different elements. One of these is the clean air, but it's also included safe climate, safe and sufficient water, healthy and sustainable food, non-toxic environments, healthy ecosystems, and biodiversity. These are substantive elements, but we also have procedural elements that at the same time are human rights, including access to information, public participation, and access to justice. And one of the key messages that I want you to understand is that when we talk about human rights, it's not one over the other. It's not that we're picking, because we don't have that luxury. And one of the key aspects for human rights is that we have the possibility, and it's a principle and obligation of states, to guarantee, respect, and protect human rights, including universality. But human rights are also interdependent, interlinked, and indivisible. So again, I want to highlight, it's not that we have to pick between rights, we have to advance solutions together. Finally, after 50 years at the UN, in a lot of conversations, the UN recognized the right to a healthy environment in 2022 with a resolution at the UN General Assembly with a historic vote of 161 states in favor and non-states against. We also have today 85% of constitutions or legislations recognizing the right to a healthy environment. This is 164 states. And in addition, the African regional human rights system and the Inter-American system recognize the right to a healthy environment, as now there are discussions at the Council of Europe and in the ASEAN region to do so. There's a lot of information and an analysis that I invite you to review in the first report that I presented at the UN General Assembly. And also my predecessor prepared a report on clean air that was presented also at the UN. There are many challenges, and because of time, I will emphasize a few of them. But one of the key ones in thinking also about this keynote that I've been thinking about is silos and compartmentalization. We cannot continue addressing the clean air issue from the health perspective or human rights or climate. We need to collaborate and coordinate, as we heard before also. So it's an imperative, as we heard as well, and that is how we advance solutions. There is no single state or institution or sector or person that has enough expertise and resources to solve this problem, but together we must do it. And that is a key thing, an element to include human rights at the center. So let me address in terms of states' obligations, because again, I want to highlight it is not a favor from states to guarantee the right to a clean, healthy, and sustainable environment. It is an obligation. But not only states have obligations, businesses also have the obligation to respect human rights. And as we heard before, one of the key things that we need is to address the drivers of this pollution. Air pollution is linked to the triple planetary crisis of climate change, biodiversity loss, and toxic pollutions. And one of the key drivers there is controlling fossil fuels. As a rapporteur, I continue seeing how states, despite of the Paris Agreement obligations in the climate change, despite of obligations in human rights, despite of the commitments to protect public health, continue to authorize increasing oil and gas offshore, but also oil and gas projects. These must stop. And there is one key element under human rights obligations that is a precautionary principle. This is a principle that is useful whenever there is lack of scientific certainty. And it has already been applied to several industries or several sectors to, whenever is needed, buy us time to make the adequate decision, so that instead of having irreversible or serious impact on the health or environment, states will advance the adequate decisions sometimes. And the precautionary principle has been used, for example, for preventing fracking in some countries and areas. And now one of the proposals that is also being done is to stop deep-sea mining in the deep-sea ocean. But we also need to access to information and participation and access to justice as an obligation of the states. I want to highlight also that there are many cases in legislations and in regional and national courts highlighting this. There's two cases, one from the European Court of Justice that was recently decided against Italy, and another one from the Inter-American system. The one in Italy is the case of Cannavacciolo and others versus Italy that was decided early this year in January, and also the case at the Inter-American system of La Oroya, the community of La Oroya versus Peru. Both of these cases highlight in a regional level what happens when states do not comply with their obligations, despite knowing for decades about the impact of air pollution in their people. But mostly, and I want to highlight this also, to people in marginalized situations. The clean air and breathing this bad air quality is not normal and cannot be normal, and we have to stop normalizing this, but it's not normal either for people in marginalized situations. Vulnerability is not natural. What is happening is the consequence of historic discrimination, and that is why it's essential to also incorporate the perspective of equity, and this is also an obligation of states to respect human rights for everyone without discrimination. We have heard constantly that not only children are more impacted. In that case, of course, the vulnerability is grown up when they are become adults. But there's a lot of people, including indigenous peoples, women, people of African descent, and people living in poverty that needs these obligations to be implemented. So thank you very much, and I really look forward to the conversation and the time.
You have been perfect. Thank you so much, Astrid. Thank you. Thank you. And please duplicate your applause for my panelists. Thank you very much. Now you can go. Okay, let's keep with these not balanced gender panels. I will invite another two fantastic women to join me here, please. Can I invite Babrin and Elaine Inoti to join me here on the panel, please? And again, you have the titles and the importance recognition of these two panelists. And after that, I promise you, you can go for a nice lunch, but not before hearing from them very important message. Where is Sabrina? If you want, please sit down with pleasure. Sabrina. Yes, please. You are more than welcome. Please. Very simple. You're from Brazil, you have a lot of experience, you have been working on this, and I want you to tell us, everybody's looking at Brazil this year because of the COP30 and because what is happening, and with a lot of hopes. So in terms of air pollution, what are you doing? How is this agenda moving?
Okay, thank you very much for the invitation. I will give you a very short message. We have a huge responsibility in the health sector with air pollution and the consequences of this exposure in terms of surveillance, assistance, communication, qualification of a health professional, but you should not work alone, isolated, and the lesson learned is that ensure the right to clean air requires more than technical tools and data production. It demands a strong legal and institutional framework, intersectoral coordination, and the integration of environmental health, energy, science, and technology policies. For this reason, we have been working very close to other government sectors, especially with the Ministry of Environment and Climate Change. We are very close. I'm mixing the names of the ministry. And it's important to mention that we produced one panel with all impacts that is possible, oriented by WHO, using the ARC+ tool as a way to communicate with the society and the health sector about the impacts of this exposure and to look at the trend. And this panel was very important for the last year. Brazil launched the National Air Quality Policy and formally established and update the air quality standards, aligning with WHO guidelines through a national resolution. And our panel was very important for this discussion and the comprehension of the other sectors of the government and the society and civil society to agree of these standards. Another point, and the second and last point, is about indoor air pollution. We are trying to understand better this kind of vulnerability in Brazil because we don't know the concentrations that the families and the population were exposed. And for this reason, we are conducting and supporting two huge research all around the country about this topic. One, just with the Black population and outskirt population in metropolitan areas, and another one with representative participants from all regions because we would like to know better this kind of exposure. What I have to know about this is that 5.5 of the Brazilian population use solid fuel for cooking or not clean cooking way. And it looks like a small number, but for Brazil and Latin America, it represents 11 million of people. It's a lot. And of course, it is regarding the low-income families. A good news is that last week was approved the year budget of the government, and we increased 6 times the budget for Vale Gas. It means a kind of a voucher to pay GLP or gas for clean cooking. And we are working with the Ministry of Mines and Energy for a national policy for clean cooking in Brazil. I have just 2 highlights, and we could talk a lot, but I know that I try to highlight these 2 important movements and trends in our agenda. And just one moment, I think that the lesson learned is that any act should not be isolated. Any action in the health sector, even one infographic, one communication, or one bulletin, should be linked with something bigger, like one policy, one governmental plan, one government orientation. This way, you could improve the structuring actions and continue forward the clean air and the human health. Thank you.
Obrigada. This is very powerful as well. And as you're right, any action should be connected and making sure that is part of the agenda. Babrin, sorry, you are the co-founder of an association that for me means a lot. I mean, it's called Warrior Moms. And I think this is a war. We all need to be warriors on this. So what are you doing in India and how much this is connected to human rights? You have Astrid sitting next to you. Astrid was telling us that since 2022, finally we have the right to a clean environment and a healthy environment. Before we didn't have the right. So what is your experience in India, Babrin? How are you fighting?
Thank you, Dr. Maria. And of course, all your encouragement has always been with us. You've been one very, very strong force for all the mothers, whether mothers in India and warrior moms or ARC It's Climate here, who are bringing all the global moms together. So we all, in our own spaces, are fighting in our own ways. Well, in India, we are very important, something what Astrid also spoke about, that it's been decades on advocacy, and we've been, everybody's been talking, there's enough data, there is enough evidence, there is science, everything is being said. But on the ground, when it's about implementation, that is where the problem is. So when the mothers actually kind of get tired of this and seeing that, one of my co-moms yesterday said a sentence that every breath is an injury to our children. That is how you feel. As a mother, you feel that pain. And you just can't go on. So we decided that we have to take on ourselves, which is basically, you have the laws. In India also, we have good laws, but obviously they're not being implemented, or we are not even aware about it. So we put those laws on simple, SOPs and share with, your own communities and your own residential colonies, etc. And that is how you empower, whether where you're seeing vehicular emissions, or you're noticing waste burning, or any kind of emissions, tree felling, etc. So you know what to do. So that makes the government and the authorities accountable. And of course, it builds a relationship with them as well, because then you are meeting them, talking to them with the local councillors, and not so much for everyone to meet the ministers, etc. So this is our first step, and it's very clearly, because if they take care, then it's very good. The second step that we come to, of course, is sometimes you end up in the courts, and which is extremely important also to empower, because we are citizens. We cannot go and change laws. Either it will be through the parliament or it will be at the courts, those little baby steps. And this is what the mums are now finding various means to, like just now I have a mom in Hyderabad who's written to me in just about a few minutes ago that there were some trees huge banyan trees being, translocated, and they've won in the National Green Tribunal to show that there's not even trees will survive, so it's been stayed. Or small baby steps like that, but then they add up, and as citizens, I think that means a lot, to us. So this is how the warrior moms are working on basically the laws, and of course, coming to the further, in a bigger picture, yes, there are bigger battles, but we kind of, work together also with, whether it's your forest department, it's your central pollution control boards, etc. You keep saying, but then it's too long, it's too tedious. And that is, I think, I want to take this stage to ask, the health ministry, the Ministry of Health, and the health departments, that they should be like the watchmen. They should be doing this for us. We should not be asking to update the AQI standards. It's for the health ministry to actually see that this is costing our children, our future, their health. And why should we be demanding this? Why, since 2021, we are waiting? 2022, we went, with 10,000 postcards signed by mothers and citizens across the country. We asked them, then we kept lingering on. 2023, we went back again wearing masks and asking them again. So this too much time goes by, and I think it's the Ministry of Health should be like the parent who should be very concerned of the citizens being affected, and like everybody said, I don't need to repeat the health cost of it, the economic cost of it. They are huge figures, and they can only gain by solving this crisis.
Thank you very much, Babrin. And please continue with the battle. You are doing an amazing work. Yesterday, the group presented a very powerful video. I really hope that we will be able to show the video to the participants later on. You need to continue because your work is absolutely amazing. Astrid, it's interesting to see how much the citizens are now taking their own governments to the court. Is this a trend that you think is sustained, is increasing exponentially, or is just increasing a little bit?
Thank you very much. It is increasing, and I want to say a couple of things about these exercises and litigation. Unfortunately, we are seeing that people that is defending the environment, including even moms in a lot of areas, or indigenous peoples, or people of African descent, and even kids, are being harassed or criminalized or stigmatized because of the work that they're doing. And so one of the things worrisome that I'm seeing is that as people is using the court or even trying to access information, they are being under attack. And so here I really want to call for people that are with the governments to remember that accessing to information, public participation, and access to justice is a right, and that by doing that, citizens are actually helping governments to do the right thing. And this is a key aspect that we need to rescue. So instead of continue defending in a lot of situations the fossil fuel industry and then their individual interest, we need to rescue the public interest. And that is one thing that is key that we're seeing in the litigation. But it's not only in national courts and now on regional courts. So I really look forward to see, hopefully, that not litigation doesn't increase, but action from states increase, so that we actually have to or can avoid going to the litigation, but because we need actions. But we are seeing this increase because of lack of results from states.
Wonderful. And I think we can be proud of ourselves after this morning marathonian starting of the conference. There will be lunch served at the Claustro de las Ánimas. It's a funny name. But but it's a very nice. And during this lunch break, there will be a very interesting lunch event organized by WMO on air quality monitoring networks and low-cost sensors. And the World Bank is launching their global flagship report on air pollution. If you are attending those events, you can take a lunch bag, a brown, don't know the name, I think you take your lunch with you, and then don't forget that the parallel sessions will start at 2:30 sharp. And please give me a big applause for my panelists. Thank you. Maratón, foi uma maratón. Eu fui corrida. Eu tenho outra sessão. Sim, eu também.